From the Minnesota State Fair, it's a political debate today for the candidates for the 4th District Congressional seat. And Curtis Gilbert is in the audience here at the fair with someone who has a question.
Yes, Mike, I'm here with Eve. She's here from St. Michael, not in the district, but she's got a question for all 3 candidates.
What are you going to do to reserve access to health care? I'm type 1 diabetic. I can't get health insurance under most plans because I have a chronic health condition. What are you going to do to maintain access to that? I've just recently got access to that. What are you going to do to make sure I can keep my health care?
Let's start with Tony Hernandez.
Thank you for that question. You know, I'm not somebody here that's going to talk about all the bad things about the Affordable Care Act. There were some good aspects of the bill. Now, they were very small parts of the bill compared to the entire bill. However, I do agree with this idea that insurance providers can't deny coverage to somebody who has pre-existing conditions. You know, I care for the people who are sick. I want to make sure that our seniors are cared for. So I think that that's a very important point. On top of that, though, we have to look at Minnesota and be very proud about the healthcare system that we have right here within our own state. We have one of the highest coverage rates in the entire world. Over 90% of our Minnesota residents are covered by some type of an insurance, whether it's private insurance or public insurance. So the model that we have here is the example that the rest of our country should be following in terms of healthcare. I'm worried that the Affordable Care Act will not be able to provide the benefits that the politicians were telling us it was going to be able to provide for. So I think what we have in Minnesota is a good system. Does it need improvements? Yes. Do we need a top-down approach to fix our healthcare system here? No, I don't think so.
Betty McCollum, oh, okay, she's deferring to Steve Carlson from the Independence Party. What about health care? What about the Affordable Care Act?
Well, if you look, in 2010 I mentioned that I had worked at the American Cancer Society for 14 months, and I had focused on a thing called health disparities. Thank you, Eve, for the question. I believe that diabetes is one of those catastrophic illnesses that we need to target. And with the American Cancer Society, what they've got is some legislation. That's the National Cervical and Breast Cancer Early Detection Program. And what that does is it targets people who are hit with these, and it gets them screening and then it gets them treatment. Now, what I have long advocated is we target killer diseases. That's where we're going to reduce health disparities. Building a big bureaucracy is not going to help cancer people. It's going to lengthen the time before they can get screened, before they can get standard treatment. The same thing with diabetes, with heart disease, with lung disease, MS. There's a list that we should be targeting. You can get broad bipartisan support. The bureaucracy is just going to slow things down. It's not going to help save people from diabetes. And we're about saving lives, not saving money. Thank you.
Betty McCollum.
Well, I'm very, very happy to say, Eve, under the ObamaCare plan, you will not be discriminated against. You will be able to go in and have the screenings and the checks that you need to have. And the American Cancer Society, the Lung Association, so many of the groups out there that are out there working in the community, trying to get people in to do the early screenings, do the early testings. We're working hand in hand with many of us in Congress to make sure we address those needs. But for seniors under the Affordable Care Act, a little thing called a copay sometimes makes a huge difference. And what the Affordable Care Act did for seniors is it removed the copay for going in for having the mammography, for going in and making sure that you had the colonoscopy, for making sure that, as Steve pointed out, you went in and got the detection earlier, so it didn't cost not only you personal harm, but it was more treasure that needed to be spent out of your personal pocket in order to treat the disease. So there are many wonderful things in the Affordable Care Act. Unfortunately, the Republicans never came up with a plan. They just said repeal. They never told us what they were going to replace it with.